great pleasure to welcome all of you to what I know is going to be a fantastic workshop. My role is very brief, you'll be pleased to learn, and it is simply to set out the objectives for this workshop, which are essentially to learn from a number of perspectives about what works in terms of social enterprise in Africa, based on people's real-life experiences, and how we can translate experience in social enterprise in Africa into learnings for Canada and vice versa. Of course, there are many, many links between Canada and Africa, and those are institutional links, government-to-government links, but certainly many of our post-secondary institutions in Canada do have very active research in Africa and collaborative academic programming in Africa. So this is all about what works, what we can learn from, and how we can share perspectives. So I know we're going to have an amazing conversation, and it is my great pleasure therefore to introduce our moderator, who is Kayla Hounsell. Kayla will be very well known to everyone as a lead reporter and presenter for CTV, also an occasional anchor for CTV, but I know from having spoken to Kayla that she prefers to be out on the road getting those stories, and we were talking earlier today about her experience covering the Air Canada crash at Halifax Airport a few weeks ago. So that's the kind of work that Kayla likes to do. What may be less well known to people, but very well known to us on the panel and probably some in the audience, is that Kayla also has a passion for human rights and journalism. And that passion took her to Rwanda in 2006 when she was a student of journalism at Carleton, and more recently it took her to South Sudan, where she spent 4 weeks training journalists in that very troubled country, and that was when we discovered what an amazing asset we have in Atlantic Canada and in Canada in Kayla, as someone who not only is a great journalist but has a heart and is able to transfer her passion, her knowledge about her craft, her profession, into some fairly difficult parts of the world. So it's an interesting story of connections, this, because I was struck when Michael Lewis was showing his picture of northern China and that degraded environment, and how that degraded environment was transformed through people and through investments in the environment to completely transform that situation. It reminded me of work I did in Darfur in the 1980s, which is many years ago. I know I don't look that old, but I was working in international development in the 80s and spent a lot of time in Darfur. And it was that experience that really taught me about resilience, because if there's one place on the planet that demonstrates resilience in the face of adversity, it's Darfur. And of course many other parts of sub-Saharan Africa are like that, many other parts of the world are like that, but I certainly learned that lesson, where people with almost nothing apparently still make it through, are still entrepreneurial, they're still making things work for their families and for their society. So it was that link to Darfur that meant that I dragged Kevin over to Juba a couple of years ago, because I'd always retained links in Sudan and now in South Sudan, and of course it was that 2 days we spent in Juba that allowed Kevin to take off and do all kinds of connecting and develop all kinds of brilliant ideas, which now means that CBU is in South Sudan. And it also means now that we're talking to Kayla about her work in South Sudan. So it's funny how the world works, really, and how these connections get made. But it's all about values, it's all about seeing the world and seeing humanity the same way. So I think we could be no better served today than having a moderator as passionate about her profession, and about the world of human rights and Africa as Kayla Hounsell. So please join with me in welcoming Kayla Hounsell, our moderator.
Thank you, Dr. Wheeler, for the kind introduction, and good morning, everyone. It's great to be here with you. It's a beautiful morning in Sydney, so we're happy that you're here inside with us. I know you won't regret it. We have an incredible panel of people put together here. They're doing some fantastic work on social enterprises in Africa, and we're going to hear from each of them about their work in just a few minutes. We'll also hopefully have some time at the end to take some of your questions. But I've been asked first just to tell you a little bit about my work so that you know where I'm coming from. So, as Dr. Wheeler mentioned, I first went to Africa in 2006. I believe it's been 9 years since then, when I was a student at Carleton University, and that was a program called the Rwanda Initiative, which sadly no longer exists, but it was a partnership between Carleton and the National University of Rwanda. So I lived in Butare, which is Rwanda's second largest center, for 2 months, and together with a Canadian journalism professor, we taught a television course to students, many of whom had never seen cameras, let alone ever used them. They were using pens and paper, and really the program aimed to foster a professional media in Rwanda. So when I ask most people what they know about Rwanda, they can likely sum it up in one word: genocide, right? It's all we ever hear about. Of course, Rwanda is so much more than that. It's a beautiful country with beautiful people, but here we are 21 years later, and much of the country, its people, and its industries are indeed shaped by genocide. So the media was in part blamed for the genocide, the international media for effectively missing the story and failing to inform the international community about the atrocities that were taking place there in 1994, but also the local media for inciting hate. And as a result, the media as an industry, like many industries, really was decimated, and there are few professional journalists there. That is changing, and I can tell you that the student journalists that we worked with in 2006 desperately wanted to be professional. They wanted to be ethical, and they have a razor-sharp understanding of the responsibility that it is to be a journalist, and they genuinely believe that their stories can change the course of their country and change the world. So that was incredibly inspiring to me as a young journalist, still a student journalist at that time, to understand that, and I believe that it really has shaped the kind of journalist that I've become over the past almost decade now. So you've probably heard before that people who visit Africa fall in love and have an appreciation, and you're just drawn and want to go back. So that was certainly the case for me. So recently, when CTV, the organization that I now work with, partnered with an organization called Journalists for Human Rights, I jumped at the chance to go back. So I'll tell you a little bit about JHR. It is a media development organization. It's based in Toronto, and its mission is to empower journalists to tell human rights stories effectively and objectively. So far, they've trained 13,000 journalists in 22 of the world's most challenging places. And that's because we believe that during a conflict or immediately after a conflict is the best time to intervene to do this kind of work. And that's because really that's when the media can have the most significant impact to highlight human rights issues and often to inform people of what their rights are. So that's why I went to South Sudan for a month just this past January. JHR works in a couple of different ways. So I was embedded at a local television station. So I worked with the local journalist in South Sudan. I went where they went. I covered the stories that they covered. And I was astounded to learn that often what they considered a story was to show up to a government press conference, record whatever the minister of the day happened to be announcing, and then simply put that on the news. They rarely, if ever, took those stories to the streets to interview what I like to call the real people, the people who are actually impacted by those stories. And sometimes that was because of resources, and we all struggle with that. But often it was because they couldn't. It was simply too dangerous. And it's interesting that you'll hear in South Sudan many politicians, and I did hear them myself in the month that I was there, talk about the free press that they enjoy. And I heard one minister say that our journalists are free, they're just not completely free. And so I would argue if you're not completely free, then you're not free at all. And I can tell you that a lot of what I saw there, they do not enjoy a free press. But part of my work was also to do workshops on many, many different aspects of journalism. So as I conducted workshops on how to write for broadcast and understanding bias and conflict of interest, it became very clear to me that the South Sudanese journalists wanted to tell those kind of stories. They just didn't necessarily always have the tools to do that. So they started pitching ideas to me, human rights ideas of stories of how to cover human rights, and they wanted to do them and they were asking for my help. And we had some tremendous examples of success while I was there, and it was great to see that. But it's important to know that it wasn't easy, and they weren't all success stories. There were some stories that journalists wanted to do, and they were all ideas generated by the South Sudanese journalists. And we didn't get to do them. And sometimes it was simply because it was just too dangerous to do it. And that's really a shame. And I'm saddened to say that since my return, the situation in South Sudan is worsening. As you may know, South Sudan is in the midst of a brutal civil war. Today, actually, somewhat ironically, marks the fourth anniversary of the independence of South Sudan from the Sudan. So on this day, 4 years ago, that country was filled with so much hope and optimism, and it's hard to believe that now the situation is worsening, the fighting is intensifying, the number of people without access to food is also escalating. So you might be asking yourself, why does it matter then? Why does it matter if journalists enjoy a free press, if people are being gang raped and killed and children are starving? Why does it matter if they can tell the kind of stories that they want to tell? But it does matter, and here is why. They as journalists are not advocates, but it's so important that they are able to tell the stories to people about what's happening around them so that they can become advocates for themselves. JHR believes wholeheartedly in sustainability, and the JHR project in South Sudan very much is sustainable. On that note, before I turn things over to my friends here, I want to share with you the words of our Canadian ambassador in South Sudan, Nicholas Coughlin. While I was in Juba, he said to me about the work that we were doing and about a free press. The work that JHR is doing is a really important area of activity these days. For South Sudanese to be able to properly take control of their country, of their very young country, as they hope they will, they need to develop the ability to communicate with their government, to hold their government accountable. A vibrant and free media are absolutely critical in that regard. There is no more important activity that can be undertaken. So that was what Nicholas Coughlin said about a free press. I hope you can think about that as you hear some of the stories of the work that our panelists are doing. There are many important activities that are taking place in different parts of Africa, and I'm so pleased that you're all sharing your experiences with us today. So without further ado, I'll introduce our first panelist, which is Dr. Kevin McKeag, a familiar face here at CBU to my immediate left. He is an assistant professor of social entrepreneurship at CBU and an internationally experienced academic and researcher of community-based and enterprise-led approaches to global poverty alleviation. Kevin has an MBA and a PhD from the Schulich School of Business in Toronto, focusing on sustainable enterprise, and a Bachelor of Arts and Science from McMaster University, focusing on international development. Over the last 20 years, Kevin has worked in 12 African countries, India and Bangladesh, including leading major research projects for the United Nations Development Program, the World Bank, and the International Development Research Center. Please welcome Dr. Kevin McKeag.
Thank you very much, Kayla. Thank you, everyone, for being at this session today. Thanks to George for organizing this whole entire fantastic conference. Thanks to some of my students who are here today, getting a break from class. So thanks to everyone. It's great to hear your introductory remarks, Kayla, and it's obvious the role that Journalists for Human Rights plays in South Sudan. And so, I was thinking about what is the story, what is our story as Cape Breton University or a Canadian university in South Sudan. And I think there is a very important role for a research-oriented university, and that's kind of part of the story that I'd like to talk about today. I think there's also a story about how we in this part of Canada, this part of the world, are familiar with challenging social and economic circumstances. Certainly it's a different order of magnitude than one would experience in South Sudan currently. But there's this sense of we have challenges, but how can they be kind of creatively addressed by working with the resources and the creativity of local people? And I think that is certainly a theme that we see very much in the work that we're doing in South Sudan with our partners there. So I think that there's a fitting kind of story about creatively working with local people, overcoming difficult situations, and trying to find solutions that work. That it's familiar to us, I think here, and certainly it's something that our partners are facing every day, and in even more challenging circumstances. So we at CBU, together with Sheila Prophet, is here with us today at the in the nursing school here. We have Canada Research Chair Ashley Consolo Willocks, and a number of other faculty members are involved in this research in South Sudan. So it's partly a story of this kind of connections that David has worked in Africa for decades. I've worked there for a number of years. And we came to South Sudan. There was this incredible optimism, as Kayla talked about 4 years ago, a newly independent country, and a lot of hope and optimism. Unfortunately, things have turned for the worst with the conflict there, the civil war, with no current end in sight. So I think, one of the question is, in this kind of very challenging context, what is the role that an institution like ours can play, like a Canadian university, and particularly CBU? So I think that there's a few things, as we've gone through this work in this challenging context. One is, searching for opportunities to contribute in some very concrete and practical way. So not to do kind of go and collect data and publish research that might not have any practical application. Making sure that whatever research and whatever knowledge that we're generating is responding to the real needs of our partners and people on the ground. So I think that is, and searching for the right opportunities where we can have a fit and make a contribution. The next important thing that I think we've learned is working with good partners. And I'm talking with Kayla, it sounds like the journalists and her local partners are journalists in human rights, an excellent example of that. And we've also been fortunate, we've searched around for local partners, and we have some great partners deeply rooted in the context there, doing some very good work. So this is not a case of us going kind of blindly and doing something all by ourselves. We have a very deep and very strong local partnerships with South Sudanese-based organizations. And then finally, how can you tell the story about what you're doing? And again, as a researcher and academic, we do a PhD, we get trained to write in academic journals, and there's a role for that, and there's an importance in creating knowledge and having that publicly available. But how can we go beyond that, and how can we engage people with videos and images and stories to try to connect us a little bit closer to what's happening there, and to motivate and engage people? So just to talk very briefly about each of these 3 points, the one opportunity that we saw in South Sudan was working with local community health workers. This goes back to what are the resources that are on the ground. They're individuals in villages and communities. They are living there, and they become trained in basic primary health care, and they then go door to door to check on women with children, check on pregnant mothers, check if there's instances of malaria or TB or what have you, and deliver basic prevention and treatment and healthcare messages. So this was one of the important opportunities that we saw, where we could maybe, together with the Faculty of Nursing and the business school, make a contribution. The context in South Sudan is that there's very limited human resources and very limited financial resources. There's only less than 200 doctors, less than 2,000 nurses in a country of 10 million people. So these local community health workers become even more important resource in that context. So what was the partner that we worked with? This was a non-governmental organization called BRAC. They are the largest non-governmental organization in the world. They have 100,000 employees. They touch over 100 million people every year with their programs. They started in Bangladesh. They're now in over 10 countries, 11 countries. And interestingly, 80% of their own budget to fund all of the development work that they do comes from their own social enterprise activities. They run businesses that meet a need that is in the marketplace, and the income generated from that funds social programs like the healthcare work that's done in South Sudan. So our research, we were building off the initial visit that David and I had in Juba. We were successful in getting Grand Challenges funding to do some pilot projects and deepen our relationships in South Sudan. And then more recently, we've been successful working with IDRC for $1 million in funding. This will be a major 5-year, multi-country, randomized control trial research to really look at what are the best ways that community health workers can generate income and receive some type of financial or non-financial incentives to reduce maternal and child mortality. So the answers to this question will be relevant not only in South Sudan, but throughout Africa, where these types of health worker programs are being delivered. So we've identified the opportunity, we've identified the partner, and now we're looking at telling the story. And when I was just there in April, I went with a documentary filmmaker. He's a former student of David, Garrick Ng. He's a friend of Cape Breton University. He's spent time out here. He's made a fantastic video of kind of the resurgence and opportunities for Cape Breton. And he came to South Sudan with us and shot this documentary video.
For me, seeing some of those scenes from South Sudan, and it's so nice to see you thinking about telling a story about the research that you do. So often we see people doing research that's hard to understand sometimes for people who aren't doing the work with them. So I'm a little biased because of what I do for a living, but it's really nice to see you putting visuals and letting people tell their stories together. I think it can be really effective. We'll move right along because we do have a lot to get to yet. Our next speaker is Yogesh Gore, and Yogesh is a senior member of the program staff at the Coady International Institute at St. Francis Xavier University. He facilitates Coady's educational programs, research initiatives, and capacity strengthening efforts globally in the area of sustainable livelihoods and market systems. Yogesh holds a Master of Public Administration from Columbia University, New York, a postgraduate diploma in Forest Management from the Indian Institute of Forest Management, a Bachelor of Engineering from India, and he is the recipient of the Ford Foundation's International Fellowship Program. Please welcome Yogesh Gore.
Thank you, Akela, and thank you, David. Thank you, Kevin. Thanks to all the sponsors, including my colleague Pauline from the Extension, for bringing me here and letting me share some of the experience on a couple of social enterprises I am working with in Africa. But before I begin, David was talking about connections, and I think this particular story that I'm going to share has a very deep connection with CBU and with David, because the co-founder of this organization, Farm Shop, was Kevin's old student from Masters, Farooq Jiva, who very closely works with me right now. We teach courses at Coady together and also overseas. And I have been associated with Farooq ever since he started working on this idea. So it's a pleasure to share this story. I think I'll just build on from Kevin's presentation on this whole idea of taking a social enterprise approach to tackling some of the biggest challenges in Africa. And one of the one of the key questions that this particular enterprise answers is how you can I mean, we all know that social enterprises, they try to achieve impact, they look at sustainability, but one factor that also is important is the scale. And what this example tells us, that how you can take some of these very innovative solutions to scale. So let me begin. I will first start by giving a little bit of background about where this social enterprise is. That's Kenya. Because I think the context is really important to understand the kind of work FarmShop is doing. So 70% of Kenyan population is dependent on agriculture and livestock for their livelihoods. So we're talking about over 30 million people who are directly dependent on agriculture for their survival. And if you're dependent on agriculture or livestock, farm inputs are very critical for the kind of productivity you will get, and also that is almost a prerequisite for you to increase your income. So farm inputs are very, very critical for those 30 million people who are dependent on agriculture. Now, one of the good things is that there is a vast network of agro dealers in Kenya. There are about 10,000 agro dealers who are the main source where these farmers go to buy their agricultural inputs and services, and they are also the main source of information for the farmers. And the farmers approach them to buy seeds, chemicals, fertilizers, farm equipment, animal feed. So they are the most important source as far as the inputs are concerned, the agro dealers. However, if we see the condition of agro dealers and the kind of services they provide, there are a lot of challenges there. So there you see in the picture, there's an empty shelf. So these shops exist, but they don't normally carry all the inputs that the farmers need. And you also see a picture at the bottom there. It's a typical agro dealer shop in Kenya, for that matter, in many parts of East Africa. What you see is it's like a prison cell, and if you are a farmer, you will go to this shop, and first you will just say, okay, I want a bag of maize seed, and first you have to pay the money through that little window, and then the shop operator will just like hand over the packet to you. That's it. And you're not allowed to go inside the shop, you're not allowed to touch the product, ask questions. And because of that, the farmers who are dependent on agriculture, where farm inputs are very, very critical, they don't have enough choice, they don't have enough options, they don't have enough opportunities to make a decision to go out and look for products. So because of that, although there are about 10,000 agro dealers, they are not actually fully benefiting the smallholder to increase the productivity and increase the income. So in this context, this social enterprise FarmShop started working to just handle these very challenges in terms of providing high quality products and services and information to the smallholder farmers. So what exactly they are trying to do, how they are trying to change this narrative. So basically the way they are trying to achieve scale is through a franchise model, a micro franchise model, franchise which is very successful in this part of the world. So how you take those successful franchise principles and apply it in the context that I just described. So the main solution is that you have a franchise network of high quality, well-trained, professionally managed shops. So the same shops that we saw will be converted into farm shops, and they will become access point for the smallholders to go and access these products and services. And so I'm sure this is a business school, so we all know about franchising. But just to give a gist, that in a franchising model, you have a franchisor and a franchisee, and the franchisor typically owns the trademark, the trade name, and provides support in terms of financing, advertising, marketing, and also training. And the franchisee actually is the owner of the shop, and then he or she expands the business. And the relationship, the way it works is that whatever services the franchisor provides, the franchisee pays a fee for that. Now the same principles if you apply in case of farm shop, is the same principles but applied in a very micro enterprise context. So if you look at this this diagram, at the very bottom are those smallholder farmers who need good quality inputs and services, and at the very top are all the suppliers of those products and services. So companies who manufacture, who produce seeds, chemicals, fertilizers, animal feed, they are at the top. So what the farm shop is doing is actually integrating this this chain where the high quality inputs are provided to the smallholder farmers. So at the very bottom are the smallholder farmers, and the stage above it is the agro dealers who are converted into a farm shop now. So those agro dealers are farm shop, and they are provided high quality inputs. They are provided training through the franchisor, which is the social enterprise farm shop, and the main functions same as a normal franchise. The same functions are there, that they provide access to finance. They do the branding, marketing. They also do the training and system development. But one another thing that they do in addition is that they are the owners of the supply chain as well. So basically all the products from those companies are supplied to those small shops by the social enterprise farm shop. So they are basically integrating the entire value chain, right from the input producers up to the smallholder farmers. So let me show you how these shops look. So you saw the shops which look like a prison cell, and now so this enterprise started in 2012, and this is the shop that look like now. The same shop, it's open. The farmers can actually go in. They can look at the product. There are different options. They can ask question to the agro dealer, and because the agro dealers are trained, their capacity is built. They are able to answer those questions of the smallholder farmer. So you see that here the shop owner is explaining to the smallholder farmer if there are any questions. They have different options to pick from, and they can come and like individually they can discuss in groups of farmers, and they can also if they have questions they can talk to the shop operator or the shop owner. So in this case, what is important, when we started and we were doing the research, what was important to find out that when a smallholder farmer goes to a shop, normally it's not the shop owner who is at the shop, it's the shop operator who is at the shop. And in almost 90% we found that it was the women who were the shop operators. So what farm shop learned very quickly is that it's not the training of the owner, it's the training of the operator that was more important. So they so in their model, training the shop operator was a very critical piece. So in this picture, this lady is the shop operator. And another piece that farm shop does is just not about providing access to quality inputs. It's also about knowledge how to use those inputs. So many of those 10,000 agro dealers were providing the inputs, but they didn't necessarily have the knowledge to transfer it to the farmer so that they can use those inputs correctly. So what farm shop does, they set up these demonstration plots in the villages, and when the farmers come to the shop, they can actually guide them to these demonstration plots so that they can farmers can go and learn from them. And some of the critical inputs in terms of products. So these shops actually do three things. They provide inputs, they provide services, and they provide information. So in terms of products, these are the very basic products that any farmer needs. So seeds, fertilizers, agrochemicals, veterinary medicine, animal feed, and all because these smallholder farmers are not producing just one crop, they are producing multiple crops. So therefore, the requirement of the products is also diversified. They provide different services. And this is the critical part which differentiates a farm shop from any other agro dealer, is that the products and services are combined with the information and advice that the shops provide to the farmers now. So as I said, that these farmers are not one monocrop farmers, because they are small, they have a small plot of land, they have to diversify their livelihood portfolio. So they will grow some maize, they will grow some vegetables, they will have a cow, maybe they will have a pig, so that they can cope up with the risk that is associated with farming. So if you have a requirement like this, where the farmer requires different diversified kind of products, then you have to offer those kind of services as well. So in a typical farming cycle, farmers continuously need feed for animal, because they have to feed them so that they can give milk. They need continuous supply of vaccination for those animals. But in small pugs, they need seed whenever there is a agriculture season. So these spikes are when they need the seeds for crops, and then followed by the pesticides and chemicals. It's been 3 years this model has been started, and the results are amazing. I visit the project every year, and some of the shops who started who were earning revenues of $400 to $500 per month, after becoming farm shop, in a period of 2 months, they break even, and on an average their increase in revenue is 500% in just 2 months. And there are some shops which started at $600 per month revenue, and they were in location where there was a lot of demand, especially for the animal input. Their revenues have increased by 4,000%. 4,000%, and I have personally met some of these agro dealers in Kenya. And because a lot of population is dependent on agriculture, this demand is growing. So right now, the last I was talking to Farouk, there are 45 shops up and running, and all of these shops at the agro dealer level. So we are talking about these micro enterprises converted into a franchise form. All of them after 2 months are making profit, but the franchisor is not profitable at the moment, and I will tell you when they will be profitable. But it tells you that for the model to be successful, both the franchisee, the agro dealer, and the franchisor has to be profitable. So what are some of the I mean, it's still early days. These are lessons learned thus far, and because we have been tracking their progress since the beginning, that these are some of the preliminary lessons. Is that inputs are a very critical gap in rural development, particularly in context of Africa. The second thing that we learned is that whatever product or service that the enterprise provides, and specifically social enterprise in any context, has to build a trust of the people, especially in a context, in an emerging market context, where the legal system is not so reliable for you to fall back on. So that's therefore your product or service that you are providing has to create enough trust with your customers, in this case the farmers. So it's very important to build that trust, and that is what Farm Shop is realizing now, that each shop has to build a trust along with that Farm Shop name. The second thing that we are learning is that so the first shop that was started in 2012 was closed down, I think, in 6 months. the first 4 shops started, 3 of them closed down in first year. So what Farm Shop quickly learned was that whatever concepts you have, you just start with them. Don't try to make a perfect model and start with 20 shops. So they started small, they learned things, and then they changed, they adopted the model, and now with that learning there are 40 shops and the iteration has gone down. So once the shop is converted into Farm Shop, they continue, they don't drop out now. So another learning is that whatever thing, and then this applies to I think social enterprises in general, that whatever idea you have, it's a good idea to develop a prototype and just pilot it quickly. Pilot quickly and maybe fail quickly, learn from it and adopt. Another thing why lot of the when Farm Shop started and we started interacting with the agro dealers, and also when I personally go there as a researcher, I go and talk to other agro dealers as well. And one of the questions we always had was that how Farm Shop is going to compete with the other agro dealers. I mean, they still have to, because they are providing good quality products and service, their costs would be high, and that's the case. But what we found over, and especially now, is that the integrated nature of service that the Farm Shop provides. It's just not about the products, it's about the services, it's about the advice that they get, which the other shops are not able to provide. And the farmers actually value that. And last is that the capacity building or the knowledge transfer of the agro dealer, as well as of knowledge being transferred to the farmer, is very, very critical. So this capacity building is ongoing. Sorry, this is the last. So as I said, right now there are about 45 shops up and running. Shops are profitable at the micro enterprise level, but the Farm Shop, the franchisor, is not profitable at right now. And when we talk about social enterprises registering as non-for-profit or for-profit, Farm Shop actually started as a non-for-profit. So a lot of their initial work of piloting, testing was done through grant support. And they continue to rely on that grant for some time. And I think as per their calculation now, they will reach a break point of in about 120 shops. So when they reach out to 120 shops, the model will become self-sustaining. It means the market will take care of it, and the more shops they open, the more profitable the model will become. All right, so that was the experience from Kenya. Thank you.
Thank you, Yogesh. Very interesting presentation. It's great to see you having that kind of success in Kenya. I'll pick up on this connections theme that David has started us off on here this morning, which Yogesh and I have realized just as we were chatting this morning. I must admit I didn't know very much about the Coady Institute before I went to South Sudan, and while I was there I actually did a feature story on one of Coady's graduates who is from South Sudan and has returned and has experienced tremendous success, and credits all of his success to the Coady Institute in Little Antigonish, Nova Scotia. So it was very nice for me to see that. And now as a result, I've made a connection with Coady, and Yogesh and I will be at another event together in October. So we are certainly making lots of connections here, and it's great to see that. Our next speaker is Netta Foray, and she is a health psychologist and adjunct professor at Carleton University and a visiting scholar at the Center for Refugee Studies at York University. At McGill University, she is the program coordinator for the Multicultural Mental Health Resource Center, associated with the Division of Social and Transcultural Psychiatry. Netta established the first virtual psychology clinic in Chad. Her work involves training community health workers in mental health delivery. I know you'll be very interested to hear her speak more about that. Please welcome Netta.
Thank you, Kayla. The way you say it, it sounds so much more important and so much nicer. Thank you very much. Yeah. So just to bring the stories together, my story with this work is a personal story. I lived in Chad for several years. My formative years were spent there. I am also a former refugee arriving in Canada some 30 years ago. So this is really the connection of my work with refugees, and in particular in Chad. This is a poem that is inscribed by the Statue of Liberty. This is certainly the image that we often get when we think about refugees, the tired, the poor, the huddled masses. I'll show you another image, which has really not much to do with that beautiful poem, but also a reality of being a refugee or wanting to be a refugee. Often we think of refugee with a little bit of pity, but being a refugee is actually a privilege. You have to be really lucky to earn that status, and there are millions and millions who do not. I was a very, very lucky one who was able to get that. So who is not a refugee? Well, most people who are in distress and outside of their state are actually not refugees. So categorization is a very, very important fact. So here you have Somali refugees in Kenya, and in the other one you have a very different type of refugee living arrangement in Georgia. It's not a new concept. It has existed long before the 1951 convention. The convention was written so that we could help, or the UNHCR eventually could help refugees in crisis. What we have right now are 35 million refugees. That is the official count, which is a total underestimation of the actual numbers. But the system that we have right now helps people in crisis, and most people are in protracted refugee situations. So talking a little bit, I will come back to it, talking a little bit about citizenship versus refugeehood, being a refugee. It's really a birthright lottery where you're born, and what are the systems in place, what are the rules, who is friends with whom and who is enemies with whom, who's doing war with whom, and at what time exactly in history are you becoming a refugee. So if I were to be a stateless person in Chad, as I was many, many years ago, if I were to be that today, I would not be considered a refugee. But at the time I was. So again, the luck of the draw. So it's a little bit problematic, and I want to talk about that very briefly because it really affects what we can do with the refugees in a refugee camp. So, and also because of the protracted refugee problem, there are many, many people who are born to refugees who are in no man's land. So quickly, this is Chad, landlocked near Sudan. I will talk to you about two particular refugee camps in what is considered northern Chad. These are Darfur refugees who have been in the Gareda region for at least 15 years. The area has about a population of 43,000 people. 40,000 of them are refugees, protracted refugees. A little bit closer just to see, it's really dry. So Abéché is pretty much the northernmost city that you can go. These refugee camps that I'm talking about are slightly further north. 48 residents. So the dots that you see, the reds and the greens, these are the actual camps. An interesting distinction is that the red ones are called refugee camps and the green ones are called IDPs, internally displaced. It is interesting that they are not put together. So the refugees, it's the same people, but depending on which side of the line you're coming from, you're going to be treated very differently. Just getting to my notes. just like to make some comments about the theories around when we look at refugee studies. There are many conceptual confusions about what a refugee is, who is a refugee. There are many synonyms. So you have the displaced, you have the asylum seekers, you have the stateless. A lot of the time we hear these terms interchangeably in the media. We also have the economic migrants. We have illegal immigrants. We have what's called even a bogus asylum seeker, and the de facto refugee. The de facto refugee is the one who gets lucky enough to have a blue identification paper from the UNHCR. And these make a difference in terms of how you bring in the help if you want to work with a refugee camp. The refugee is, the de facto refugee stands outside of many sorts of protection that would be provided under human rights. They no longer have their sovereign protection from the country of origin. They have no protection from the host community quite often. There is land that is leased by the UNHCR and they live in that area. And some of the rules that are put together to protect them to begin with, such as keeping them together, are also the rules that are not allowing help to get in. So a lot of the time refugees are not allowed to leave the camp. So they're very much encamped. The worst scenario of that is, of course, in Australia or off the island, where the refugee camp is actually run as a prison by a corporation, and they can't get off the island. So the context is within most refugee camps, but specifically in Gareda, is the people who've come to the refugee camps. Of course, they have their own mental health issues, which would be like anywhere else. But then once they get to the refugee camps, now they have new mental health issues. And it's really difficult to get to these camps more than anything else. Even if we could get into the camps, how do we help them? And who am I as a psychologist from Canada to go in there and diagnose mental illness? Because as we know, mental illness is very much determined by culture and context. And so even if we could get in there and we had everything that's required, we can't really do that work. We really need the people themselves to do that, but how do we train them? And in order to, one of the best ways to improve mental health anywhere is to give people a sense of agency and self-determination. And that is what is taken away from the refugee. They're not allowed to own land, they're not allowed to make decisions for themselves, they're not allowed to work. And this is where social enterprise comes in, and I'm really here to learn from all of you because this is not my background and I would love to hear your ideas. And I'm definitely eagerly awaiting the results coming out of South Sudan to see how the community health workers and the social enterprise are coming along and how we could use the results and what they learn in the Gareda camps. So people in the camps, when they arrive, they have witnessed war. There's of course a lot of trauma and some versions and variations of post-traumatic stress disorder. Often there's separation from families, there's a lot of anxiety and isolation, and chronic stress. And as we know, anxiety and especially chronic stress is really the bread and butter of psychologists. This is what we work with all the time. Chronic stress will make you sick, and this is what's happening in any refugee situation, a protracted refugee situation. There's a lot of stigma around mental health, any kind of health, but especially mental health. So getting mental health help into the camps is very difficult, because if you go and you provide the help, then you have stigmatized the person who's received the help. In order to help them, in order to provide help and tools so that people can help themselves, one of the best ways is to allow them to work. And so one idea is to see, well, can we bring some form of cooperative where we can get around the laws that govern the refugee camp, such as no working and no access to money and no ownership. Can we somehow get around these through social enterprise and through the use of cooperatives? to get around the formal, the fact that there's no formal economy, there's no sovereign protection, there's no ownership, and very limited resources. How can we get around that? There's also environmental insecurity, and there's food insecurity, and the connection between food insecurity and mental health is often around gender-based violence. The women are responsible for feeding their families. They must leave the camp environment to go out and gather wood, and in that process they're often attacked. And then there's stigma, of course, attached around that. So what is happening is that families are now trying to get their daughters married off early before a rape or a pregnancy occurs. So now we're really introducing new problems, and on it goes. So this is one of the areas that we're looking at as well, specifically around gender safety. And is there a way, can we help gender safety if we help with food security, and what are the ways around that? In terms of mental health and what is available, so there are, the area hospitals are quite strained. They see 500 patients per week per hospital, so we're talking about 48,000 residents. So the refugees and the residents are receiving the same services, including food that is delivered by the World Food Program. Mental health, so we talk about depression, psychosis, and various forms of psychosis, and then schizophrenia in particular. But epilepsy is also considered by the World Health Organization a form of mental health issue, and it is put together, and it's a common problem, especially because of malaria. The hospitals don't have inpatient facilities. There's no referring possibilities. So if whoever is attending cannot help the person, this is it. There's nowhere to go. And there are no community resources. So the mentally ill are often chained. They're considered a danger and quite bad for the family because of the animist culture. The psychotropics and medication is also very limited. Especially injectables in case of psychosis and schizophrenia. What you want to do is to inject people so that we don't have to rely on them taking the pills. So this is me going there and talking to people who are doing health work and say, okay, what kind of help do you need in order to assess the mental health problems of the population that you see? So let's look at what you're seeing today and what are your needs. The context and culture is very similar in that area with the sub-Saharan Africa. You have genital mutilation that's still happening, uvulectomy, removal of milk teeth. So these are things that are adding to the health problems, existing problem, conjugal violence, family conflict. Women prefer husbands over children because of the problem with food security. They can always have another child, they can't always get another husband. There's a caste system, there's different social standings, and the problems that people had in Darfur that are causing whatever the situation is over there that is causing the problems, well, it's the same people. So when they come to the camps, they have the same problems. So the camps are not necessarily, they're camps. But what I'm trying to say is that the problems come with them. The social problems that were there are also now represented again within the camps. Stigma, as I said, is a big problem because of HIV. People don't want to be, je ne suis pas fou, I'm not crazy. This is a big one. So community health workers have a very hard time actually making house visits. Another problem is with the unemployed males. Women tend to keep busy, the men don't, and it causes often a lot of mental health issues. Decreasing food rations, the World Food Program, as a way of trying to make people more self-reliant, has had the brilliant idea of decreasing the number of calories that people get, hoping that this would make them more likely to try and become self-reliant. What has happened is that the women have to now go out more often, and so now you have more gender-based violence and rape that are occurring. And the budget, of course, the food budget and various food budgets are decreasing. So the UN and the WHO agree that refugees suffer from chronic psychosocial distress. So that is, we're learning more and more about it as researchers are getting into the camps and doing studies. They're very challenging environments, and delivering mental health and any kind of health service is incredibly difficult. And even if we could do it from here, we're really imposing, and we have to really worry about bringing another neo-colonial system over there with our ways of looking at mental health problems. So what can be done? Can we use established models? Can we start with what is already there to see if we can put them all together and look at some of the evidence-based? So some of the established approaches are various forms of economic organization. So can we bring a social enterprise, and can we bring a cooperative? So one idea is to have, since they cannot work, but they can, or rather they can work, but they're not supposed to be paid for it. So we can have them to volunteer, and then somehow find a way, such as matching funds to provide money for the work that they're doing. The good thing about social enterprise and a cooperative is that there are models, existing models that can be used. There are voluntary membership, they're jointly owned. So even though we have no ownership, we're really trying to get around that. And we can bring social cohesion, or that's the idea, through a lot more cooperation, especially between the refugees and the host communities, and bring back some form of human agency, bring back some form of self-determination. So training of non-specialists, that has been done. I'm involved with a project in Nigeria that is training community health workers to provide mental health. It is successful. It has its issues like everything else, but that seems to be really one good way of going about it. And it can be supported virtually. As Kayla said, I run a clinic virtually in Chad. The country has no psychologist. It has one psychiatrist who's actually quite ill and not working. So really, there's absolutely nothing. It's not a void, because you have various forms of mental health through traditional healers, but actual psychological help and clinical help is not available. So I started this Skype clinic that has had some success and a lot of demand, quite limited in what it can offer, but the idea is to just have more people trained so that can be done locally. So can we use the same idea over there? We know that Médecins Sans Frontières, Doctors Without Borders have used this system in Somalia, and it has been successful. So the training needs for the women who would become community health workers would be basically around capacity building. Can they do diagnosis? Can they do intervention? Can they provide patient support? So these are the ideas that we need to do really an ethnographic study and decide which are the particular ones that we want to address. And it seems that the ones that are really important right now would be psychosis, some form of psychosis, which is common, and epilepsy. And then teaching the community to care for itself and reintegrate the mentally ill. So we're trying to combine various expertise from different approaches and see if we can build a cohesive model that could work within the limits that we have that are very particular to the refugee camps. So the objectives would be to provide gender safety, establish some sort of informal economy and autonomy, decrease hours of physical labors. So in the abstract, I talk about solar kitchen, for example. These are some ideas that have been tried out in the past. Can we bring solar kitchen, some kind of a community kitchen? What that does is that it prevents women from having to go out to gather wood, and that would decrease the number of rapes that are happening. That has been tried in sub-Saharan Africa. Women don't particularly like solar kitchens, but where they are being used, they have been successful, and gender safety has improved. So now, if we could do that, if we could allow women not to go, we get about 4 extra hours per day. So they now have 4 extra hours that can be used to train them and for them to work as volunteers. So social enterprise and food technology, bringing it together. And this is our proposed methodology. How am I doing with time? Good. Okay, so we want to start with participatory research, where we go in there and we ask people to teach us about what their needs are and what their issues are. Identifying key partners who are working there. In the case of refugee camps, there would be NGOs who are on the ground, doing some sort of preliminary analysis, situational analysis, and adapt the project that we're proposing accordingly. And then in phase 2 to go in and actually implement the project and follow with monitoring and evaluation. Thank you.